topic, we're going to discuss about National Policy for Persons with Disabilities 2006. This is a very important question for D.Ed, B.Ed and M.Ed. So let's begin. The National Policy for Persons with Disabilities was started on 10th of Feb 2006. Now, it was started by the Ministry of Social Justice and Empowerment. Now, this ministry is actually under the Government of India. It's a ministry which is owned by the Government of India. And this ministry takes care for the welfare, for the social justice, for the empowerment of the weaker sections or the marginalized groups in the society or the disadvantaged groups in the society. Now, this policy is very comprehensive, means it is very wide, and it takes care of the areas in which we can make the persons with disabilities as valuable. They consider that even though a person is having a disability, still that human being is valuable for the country. So this policy makes sure that we could create such an environment for them, for the differently abled or the persons with disabilities, that they can equally participate in our society. Not only this policy also makes sure that they get equal opportunities so that they can freely participate in the society. This policy focuses on several heads, such as prevention of disabilities, means how can we prevent such disabilities from occurring in children? What are the precautions parents can take? Second is rehabilitation measures. Now, rehabilitation measures over here means these are a set of measures which are taken by more experienced individuals so that they can assist the persons with disabilities and help them function in the society, in their environments. Then we have physical rehabilitation strategies, means what are the different strategies we could adopt so that we can prevent, we can diagnose, we can treat the differently abled and also the disorders by all physical means. So in this category we are having 4. The first is early detection and intervention. This means that the disabilities in a person need to be detected or need to be identified at an early age, that is their early childhood, and we need a proper intervention to it. Now, early intervention over here means we are going to identify and we are going to provide an early support to the child or to the young person who are at the risk of this disability. The second one is counseling and medical rehabilitation. Means proper counseling needs to be given to the parents and to the children, and proper medical care needs to be given to them so that they are able to develop themselves, or a proper support is being given to them and they are better treated. Assistive devices. Now, assistive devices are external devices, or we could say they are specially designed or made or they are adapted so that they are being able to assist a person in a particular task, like whatever disability the person is having. Suppose if a person is having a hearing disability, then a hearing aid is provided to that person. So those are assistive devices. Development of rehabilitation professionals. Now, they are a workforce which are a group of health workers, like let's say a psychotherapist or an occupational therapist or an audiologist, whatever disability the child is having. Based on that, you appoint a specific professional for him or her so that the child and the parents get proper guidance how to handle this disability. Next is education for persons with disabilities. Means this policy, National Policy for Persons with Disabilities, is going to make sure that even the person, even if he's having a disability, he still gets education. He's not lagging behind because of his disability. Economic rehabilitation of persons with disabilities. Now, economic rehabilitation over here means that they're going to fight against their poverty and they're going to find local solutions and they're going to recover from poverty. Now, this policy is going to help the families of the children with disabilities by providing them a proper rehabilitation economically. Under this category, we have 3. First is employment in government establishments. Means even if a person is having a disability, still that person will get employment. He won't be unemployed. They're going to be appointed in government associations or establishments. Wage employment in private sector. Means even a person with disability can work just like a normal person in a private sector and he will be given salary for the work he is doing. Next is self-employment, means a person with disability also gets a chance to own a business, to operate a business, or to become a partner with someone else in a particular business. He can also conduct profitable operations, he can give salary to his employees just like a normal person, and he is also liable to pay different taxes like income tax, etc. Next, we have women with disabilities. Now, even women and girls can face a lot of disabilities during their life, like they can also face double discrimination at places. They can face gender bias, sexual abuse, neglect, maltreatment, exploitation, etc. So, this national policy also takes care of women with disabilities and provides some support. Children with disabilities. Now, children with disabilities also include those children who have a very long term disability, like it could be physical, mental, intellectual, like related to the brain, or sensory impairments related to our five senses. So, all these barriers are like a hindrance. The stopping the child to participate completely in the society on an equal basis. So, this policy is going to support those children also. Next is barrier free environment. Now, barrier free environment is such an environment which helps people with disabilities to go around, move around safely, freely, and to use the facilities whatever are available in the built environment. So, barrier free, just in simple words, means without any restrictions. Like how you don't restrict a normal person, similarly, why should you restrict a person with disability? So, those restrictions are prohibited. Next is issue of disability certificates. Now, disability certificates have a lot of perks for such children, like proper scholarship schemes will be provided for students with disabilities, concession for railway fare, then rebate in income tax, then reservation in government jobs, free travel in state transport buses, loan for starting own business, getting access to proper assistive devices such as a wheelchair. So this certificate of disability, it will be provided by the government so that the persons with disability can get access to all these perks. Social security. Social security over here means that certain benefits will be given to the family of the person with disability who is not able to work due to a medical condition which prevents him or her from working for at least 12 months. So, financial support is given, that is social security, through this policy. Then we have promotion of non governmental organization. Now, these organizations or NGOs are going to provide a great support to the person with disability. Like they are going to ask before offering help, means already the person with disability knows that they are in need of great help. They know their needs. So it is better to ask them first whether they need any help or not, and explaining things to them in very simple and clear words. They won't understand complex views or sentences. Then making them feel confident and giving them their personal space, giving them respect, and making changes wherever necessary. Next is research. So, a proper research on the disability identified is to be done. If proper research is done, only then we can have a better intervention. Sports, recreation, and cultural life. Now, it is the job of this policy that it makes sure that persons with disabilities get equal opportunities and proper programs are organized, developed, so that person with disabilities can also participate in specific sporting and recreational activities. They are being encouraged, they are being given chance on an equal basis, and proper instructions are provided to them, proper training, proper resources, etc. Amendments and existing acts dealing with the persons with disabilities means we can make certain and minor changes or alterations, or we can rephrase the constitution, laws, and bills for better improvement of the persons with disabilities. So, the main highlight of national policy for persons with disabilities is that it wants to ensure that even if a person is having disability, still that person gets equality, freedom, justice, proper respect among all other individuals. And it makes sure that this society becomes an inclusive society, means it includes even the disabled persons with the normal persons in a normal school environment. And in the recent years, we have also seen many positive changes in the thinking process of the society, in the perception or the views of the society about the persons with disabilities. We've seen that even if a person is having a disability, still he can lead a better quality of life if he's been given equal opportunities and proper rehabilitation measures have been taken for him.